Good afternoon, everyone. Welcome to our webinar, Not the End of the Story, Understanding Late Effects of Cancer Treatment in AYA Cancer Survivors. My name is Dr. Michal Bohdan. I'm from the Medical University of Gdańsk, and I represent the MAIA project. And it is my great pleasure to welcome you and moderate today's webinar. On behalf of the Quality of Life cluster, I would like to thank you all our wonderful speakers and all participants joining us from different countries and professional background. Today's webinar will bring together several Horizon Europe projects that work on different aspects of cancer survivorship in AYA patients. So I'm delighted to welcome representatives from Transcend XR study, Predict AYA study, PanCare for AYA study, MAIA and Late AYA study. I'm also especially pleased to have with us Ms. Ketiona Malolli, psychologist, patient advocate, and co-researcher in the MAIA project, who will share her perspective of a young cancer survivor. Ladies and gentlemen, our audience today includes healthcare professionals, researchers, project managers, patients advocates, and members of the wider community interested in improving survivorship care. Our webinar today will be organized into two scientific sessions. First, understanding the risk before late effects appear, and then living with and monitoring late effects. At the end of the session, we will have time for questions and discussion. So please feel free to submit your questions in the chat throughout the webinar. And before I introduce our speakers, I would like to begin with a brief overview of what late effects are and why they represent an important challenge for adolescents and young adult cancer survivors. So let's start the webinar, and I will share my slides. Hopefully you'll be able to see that. Okay.
Yes.
So first, I would like to start with a short clinical overview to really understand what the situation is. We have a large number of children and young adults who survived cancer treatment. These numbers have significantly increased in the last decades. And current cure rates are up to 80% in children and adolescents. So we are seeing a growing number of patients with a history of anti-cancer treatment. So the key message here is surviving cancer is not the end of this story. What are the late effects we are discussing today? These are mainly health problems which occur months or even years after cancer therapy has ended. And this can mean everything, literally, starting from cardiovascular diseases, cardiovascular risk factors, going into infertility, some other health issues, but also mental health problems such as anxiety, depression, and sometimes social and occupational difficulties. So very important thing about AYA is that our patients are different from the general population, because they face cancer treatment, anti-cancer treatment, during some say critical life stages, which can be education, university, when they start to get employed, when they start to have relationships, and when they start to think about having a family and family planning. So these late effects may severely affect decades of future life. So there are various types of late effects, starting from physical. We discuss them a lot in our cardiovascular society. So this is a broad term called cardiotoxicity, with also metabolic syndrome, infertility. But there are also really important other aspects which are addressed currently more and more, such as psychological, social, and cognitive effects that have to be diagnosed and also taken into consideration. So the question is, why do late effects occur? Of course, this is due to our anti-cancer treatment, and we have lots of various data that help us to understand what the cardiotoxicity associated with anti-cancer treatment is. So generally, we have various types of anti-cancer treatment, all of which can have some side effects and can lead to development of late effects. And it is very sometimes difficult to predict who's going to be at risk, because this will be dependent on the patient's age, sex, type of anti-cancer treatment, and also other factors. So what are the clinical consequences of cardiotoxicity in our patients? We know that patients who developed cancer and undergone anti-cancer treatment have a higher risk of cardiovascular diseases, and usually the development of those diseases may happen earlier than in the general population. So it is very important to implement primary and secondary prevention to mitigate these effects. According to data, 60 to 90% of long-term survivors will eventually develop at least one chronic health condition. This can mean cardiovascular, reproductive, and endocrine disorders, and it's very hard, as I said, to predict which type of complication the patient will develop. So the very important issue is to help our patients, our cancer survivors, to make this a successful transition from pediatric to adult setting. So cardiotoxicity, which is very, very broad term nowadays and quite widely described, is just one example of late effects. And from my perspective as a cardiologist, maybe one of the more important, but other factors are really also important in our cancer survivors. So what is very essential to remember, cardiotoxicity is just a tiny part of the whole spectrum of things that we have to deal with in our cancer survivors. So what is the challenges? We are still trying to learn what are the needs of our patients. And there are a few problems that have to be taken into consideration. Many of our patients are lost to follow up. We still are trying to develop strategies to have them in our follow-up. Patients usually are not aware that they have certain risks associated with anti-cancer treatment. They often receive fragmented care, and this is something that we have to improve. And they develop complications years later after the treatment. So it is sometimes really hard for cancer survivors to really have this in mind, that they have to monitor themselves and still look closely for any adverse effects. So we need prediction, we need screening, we need monitoring, and we need some digital tools. And of course, the patients have to be involved. So today's journey will be divided into two parts. First, we are going to understand the risk before it appears. And then in part two, we're going to have living with and monitoring late effects. And most importantly, we will have the patient perspective. So to sum up this part, I would like to say that cancer treatment may end, but survivorship continues. And so that's all from me. And now, as we have seen, those late effects can affect many aspects of lifelong after our anti-cancer treatment has ended. But really important to say is that statistics and this clinical data that I presented tell only part of the story. And in order to truly understand survivorship, we must also listen to the experiences of survivors themselves. And it is therefore my great pleasure to introduce Ms. Ketiona Malolli.
Hello, everyone. Thank you so much, Michal, and thank you for having me here.
So my name is Ketiona Malolli. I live in Greece, in Athens. I'm a psychologist, and at the same time, I work as a patient advocate in European projects. And I am here, to speak today as a co-researcher in my project, but at the same time as a person with lived experience of cancer. So very quickly, my story is that I got diagnosed when I was 13 years old. I had osteosarcoma, and I continue being inside and out of hospital for about 3 years. So since then, I have been living also with a disability because my arm was amputated. And since 2019, I have been active in patient advocacy that has to do with eye cancer and childhood cancer at the same time. And I also volunteer in CCI Europe and in the Greek organization of childhood and adolescent cancer survivors. And these two roles that I have in the project for me are very, very essential because they shape how I understand, what patient advocacy really is and how survivorship should really look like. And this is what I would like to talk about today and share my own perspective, because we all know that cancer does not end with treatment. We are all aware of that right now. And in survivorship, we say that it starts as soon as the diagnosis comes and not after that, because a lot of things has to be done from the very first day and not at the end of the treatment or after that. And a lot of late effects come and are invisible and we don't know them. And sometimes people never talked about it. So when I was a patient, no one would tell me that in 15 years you should be aware of your heart and you should do your checkups with your cardiologist every year, because you might have cardiotoxicity and it might occur something after 15 years. And these are things that I am now learning. And this is not an individual issue, because it happens to every person with lived experience. And if it ever happens that you join a group of people with lived experience of cancer in a young age, you will listen all the time. I was never nobody ever talked about that to me, or I would never imagine that this would happen, or I had no idea that, this might occur. And the healthcare system is difficult to navigate in all the countries, not just in Greece or in European countries. And we are expected to have our own control of our exams and our health, but this is not structured. And this is a big responsibility for people that don't have the right information to do it by themselves. And this is a great gap that we have in the survivorship care. And I think that this project is a great example of how to bridge, that gap and how to address those issues. Because what this project does is that it is trying to reshape, or maybe to shift the approach, from the hospital, episodic hospital care, to a continuous type of care that the patient really understands and they are really active of what they are doing and how they are really navigating their own life and their own quality of life, that it makes sense to them. It's not just you have to do this, you have to do this, you have to do this, and you're done. So this project really brings, the voices of the person, the patient, or the survivor in front. And by combining all the digital tools and the AI tools, especially now that young people are more and more active in those type of technology, it makes it even more easier for them, to be active and to say, okay, you know what, I understand this, I can check up this, I can take my phone and see how this works or what I have to do. And this brings us to have a goal, not just to monitor our health, but to really make a difference in the model of care that we have until today we had, and how we want it to be in the future. And my role as a co-researcher For me, it is not something optional, because it used to be optional, you should have a patient advocate maybe or something, but it is very, very essential, because we understand very, very well how we want to be talked about things and what we really want to navigate, and what information we really need to say that, I can do this, and this makes sense for me. So it makes sense for me why I should use this app, or why I get all this information. And we wanted to have them really, really understandable. And sometimes people say just we click the box, so we have a patient advocate in the project. Yes, let's just tick the box and move on. But this project does not work like that, because we are very active from the very first day. So from the designing and all the things that need to be done step by step, until the very last day, that things will be out there. Are they relevant? Are they understandable? So we are there, to sometimes to ask the hard questions and say, okay, good, it's good that you did it, but does it really make sense? Is it really understandable? Is it really something that people with lived experience are going to use? Or is it something that, we have seen so many things like this, we don't want to see another one? And, we want to make it practical. And this is why I believe that we always need, a co-researcher to have them from the very first day of designing something until the very last one. And this is why I'm grateful, that I am so active in this project. And it brings some opportunities, not only for people to navigate their own quality of life and their own health, and to find their own steps on how they want to keep track of what is being done in their own life, but also it give opportunity to people that says, your lived experience and your knowledge are very, very important to us, and we really want to use them and to have them and to get something very, very important done out of it. So it's not just a box, it's not just a title, but it's something that we want you to be active in it, and we really need your voice and your input in this project. And this is what makes it, for me, a great example of best practice of how to incorporate patient advocates and people with lived experience into projects and into guidelines and into decision making. So ultimately, I would say that the Maya project is not just a project of preventing late effects, but for me, it is a project that shifts the way that we see the systematic care, the healthcare systems, and we go from just surviving, cancer, to living well and having a good quality of life. And this is, what I would love to see in the future, to have people with lived experience active into this decision making. So I'm very, very grateful for being here, and thank you for listening to me.
Thank you very much, Ketiona, for sharing your experience and for reminding us that behind every data set, every guideline, and every research project, there is a real person living beyond cancer. So thank you very much for that. And we now move to the first scientific session, which is called Understanding the Risk Before It Appears. Our first speaker is Dr. Maria O'Malley from University College Cork. Dr. O'Malley works in the Transcend XR project, and her research focuses on mental health, well-being, suicide prevention, and cancer survivorship. This project aims to improve the lives of AYA testicular cancer survivors through innovative digital and immersive approaches. So Maria, thank you for joining, and the floor is yours.
Great, thank you, and thanks, Michal. I'm just going to share my screen, I hope, anyway. Let me know if you can see that. Can people see that?
Yes.
Perfect. Okay. Okay, so as Michal said, our project Transcend XR is really about the co-creation and implementation of an intervention that we hope will improve the understanding of testicular cancer, the late effects, and the unmet supportive care needs for IA survivors using extended reality. So this is just to acknowledge the funders. So I suppose we were thinking about the challenge and we focused specifically on testicular cancer. We know that people are living longer. We know that there's better treatment, there's lower mortality, but we also know that the higher cure rates from testicular cancer do lead to an increased risk of late treatment effects, such as secondary cancers, cardiovascular disease, lung, kidney, and neurological toxicities, as well as fertility issues for people and psychosocial problems. The literature and the evidence also tells us that TC survivors have various unmet needs. These are psychological, they're physical, they're interpersonal and intimacy related, and they're also around health system and information needs. People who have had testicular cancer and have had treatment, they're quite often unaware of the late effects from the risk following treatment. And this can interfere with self-care and it can interfere with the person's quality of life. So the interventions that educate and support AYA TC survivors are urgently needed. So just understanding the late effects. So although some late effects like cardiovascular disease or secondary cancers can't be fully preventable, risk can be reduced or modified and outcomes improved for people through risk reduction strategies and early detection. So in our project is really about ensuring that testicular cancer survivors have the knowledge around late effects, how to recognise late effects, how to prevent them, how to report and manage late effects, and that this may promote healthier behaviours and improve quality of life. And I suppose just focusing on knowledge, because that really is one of our primary outcomes. We want people who've had testicular cancer to have more knowledge, because we know that knowledge can encourage monitoring of effects, recognising effects and early detection. We also know that people who have knowledge around late effects, that this can promote healthier lifestyle choices, improve their adherence to long-term follow-up care, which Michal has already highlighted can be an issue, particularly in this population, but also enable people to introduce some risk reduction strategies. So just a little bit about the project. So our intervention has been co-designed. And what I mean by co-designed is that in one of our work packages, we have undertaken world cafes. So world cafes would be something similar to focus groups where we've invited testicular cancer survivors, their care partners, health care professionals as well, into a space where we've asked them questions around what do people need? What is the knowledge and the information that they need? What are their unsupportive care needs? But also we've asked them, what should this intervention look like? And this is the co-designed piece. So it's going to be educational and supportive self-management tool that's evidence informed. And we knew at the beginning we were interested in extended reality. And like I said, that's something then that was explored. What would this actually look like in the world cafes as well? So just to say that Transcend XR, like I said, the aim is around education, particularly around late effects of testicular cancer treatment and supporting people to obtain a better quality of life. So we've 15 partners across 12 countries. We've 8 work packages that kind of organise the project. And we're a year into a 6.5-year project. This is just a list of our partners. I won't go through them all, but it's just to give you a sense of I suppose, the diversity of our partners. So we've 8 work packages, like I said. So the first work package is occurring, and that's where we developed a survey, which has gone out across Europe through clinical partners, asking people their experience around testicular cancer, their treatment, any late effects that they may have experienced, but also asking them about their use of extended reality. And findings from that survey are feeding into work package 2, so they're kind of happening at the same time, which is the intervention co-creation. Then we need to refine it, and we need to do a technical validation. There will then be a pragmatic RCT, and within that RCT there'll be a health economics evaluation process evaluation, and we've embedded ethics, sociocultural and policy implications as well. So I suppose just to say again, our aim is that we 500 people across Europe who have experienced testicular cancer and are in survivorship will engage in the survey that is currently live, and findings from the survey will feed into work package 2, where we hope to meet with 200 survivors, care partners and clinicians, and that process has started to build the intervention. And then we, like I said, we'll have a pragmatic RCT, and then we'll look at long-term sustainability and how to integrate the intervention across Europe. So I suppose, where are we at? So our data collection is underway for work package 1. We've undertaken a rapid, although it didn't feel that rapid, literature review of clinical practice guidelines and guidelines for patients, specifically in the area of testicular cancer, but then we also moved a little bit broader to look at some of the clinical practice guidelines around survivorship and AYA survivorship guidelines as well. And findings from those guidelines are informing the content of the intervention, as well as what people are saying they would like to see within the intervention. We've protocol for the trial, and we're actively disseminating. So our next steps are to analyse the findings from Work Package 1 to ensure that it's informing the intervention. We're working on modules for Work Package 2, and again, the content of these modules has been I suppose informed by clinical practice guidelines that are already available, but also what participants in the World Cafe are telling us. So we anticipate that there'll be 5 modules, and we will cover things like, the test days, the function of the test days, how to do self-exam. We have a module on the heart, so that will cover all kind of cardiovascular issues, but also, I suppose, ways to stay healthy. There'll be another module on the social aspects and components of post-testicular cancer, and in there we're looking at healthy lifestyle, maybe challenges that people might have around school or work, challenges in relationships and intimacy and making connections. Like I said, there'll be 5 modules. We're going to iteratively test these module prototypes within World Cafes. So one of our partners is providing, the content. The participants agreed in earlier World Cafes that virtual reality would be the way to go. So that has been agreed. So we have VR headsets, and people will engage in the content over a particular period of time, and then we'll test it in the RCT. So that really is Transcend XR in a nutshell. We're very excited about it. Like I said, our primary goal is to increase knowledge, address some unsupportive care needs, and hopefully improve people's quality of life. So I'm going to stop sharing.
Okay. Thank you very much, Maria. We will have more time in the end for any questions. And let's continue. We know that prediction and prevention are essential if we want to reduce the burden of late effects before they develop. It is therefore my pleasure to introduce Dr. Kenny Rodriguez-Wallberg from Karolinska Institutet. She's a specialist in reproductive medicine and fertility preservation, and serves as the coordinator in the Predict Aya project. This project focuses on understanding and predicting long-term treatment effects in adolescent and young adult cancer survivors. Kenny, thank you very much for joining us today, and the floor is yours.
Thank you. I am representing the project Predict AYA, and as the title says, this is a project that aims to predict and prevent late effects in adolescent and young adult AYA cancer survivors. So the next slide shows how extended our project is. This is a project that will run for 5 years, and you see the participants of the project in this slide. This is 18 partners across 10 countries, but with our partners, we are getting some other more countries participating in our project. I will explain how. So the next slide shows the background. Why is our project relevant? Why we decided to work on this? And it's because working as a fertility doctor specialist in fertility preservation, I meet a lot of patients with cancer. They are young, sometimes they are very young, and they have a lot of questions regarding the effects of their treatments in their future life. Fertility is a very important issue for young people, and this is more or less newly acknowledged. It has been cancer and cancer treatment with a very huge focus in survival, but as the cancer treatment is becoming so good in treating the disease, people are surviving more and more, but they are surviving with a lot of effects that are consequent of the cancer treatment. And we know that one of those effects is the damage of the reproductive organs. The ovaries and the testes are very sensitive to chemotherapeutics and to radiotherapy, and the patients develop infertility, sometimes also impaired sexual health and other late effects that Michal has spoken about, for example, other late effects in other organs, such cardiotoxicity, for example. So we are seeing more and more these effects, and the patients are requesting more information about this, and could we do something to avoid this effect? Or probably in the future, we are going to develop new therapeutics that can be chosen because they will have less effects in some people. And when I say some people, what I want to tell you is that we don't know why some individuals develop late effects and some others do not. Even if they have a similar disease, they receive a similar treatment, and they are on the same age. So we would like to know better why this is happening. What are the determinants of this ultrasensitivity or more resistance to developing of late effects? And this is very modern now in the era of individualized medicine, precision medicine. We don't know why some people develop infertility and some others no, not even in the case of similar treatments, and we would like to know why this is happening. And the only way is to go very broad into the population and try to see what was the difference or who was not affected. At the moment, there is limited evidence on infertility, and if there are people that are less affected because the studies are on small cohorts, and we are just in face of an unmet needs from our patients. They would like to know better. They would like to have a better prediction on what's going to happen. And maybe in the future, as I said, we could choose a right treatment to the right patient. So the next slide shows the objectives of our study. This is a research project. with colleagues that work in fertility preservation as I do, but also oncologists working with cancer patients in many conditions. And we are not selective to any tumor. We are taking into consideration all diseases. And already in Europe, there are several cohorts, patient cohorts that have collected clinical data. So if we go very, very broad into this data and put it together, we could see the differences among individuals. So our project is aiming to advance an understanding what is the incidence, the severity, and the impact of late effects. Maybe if one person develops a late effect, it could develop some other late effects. So we would like to see the interplay of those. We plan to build our project on data that are already existing in European countries, but we will create also new data by following patients in the future. And we hope that we will support individualized screening and fertility counseling appropriate to the patients. So the next slide shows our approach to look into the problem. We plan to do this in 4 different ways. So the first approach is to go into population-based data already available in European countries and using epidemiological methods is a kind of statistics that help us to look into big data. We will determine who are the individuals that are more affected with late effects. Our focus is on reproductive medicine and infertility, but we will see also other late effects because today there are diagnosed codes to find those and also prescription medicines that also are needed in certain diseases. Apart from this very large epidemiological data, we will use the cohorts that already are available at our clinics. This is what we call a retrospective study. We will use this retrospective large data together with our colleagues to look what has happened to people that already has been treated for cancer. But we also will do prospective studies. It means that we are going to invite new patients to participate in our studies, and we will follow them and we will take blood samples and we will see how their fertility is affected. We also are going to map the availability of fertility care for cancer patients in European countries and the satisfaction of the patients with those services across European countries. When we will have the information about who are the more affected and less affected individuals and looking into an individualized basis, we will be able to invite the patients to give us a sample for genetic analysis. And we have some ideas how to predict, according to the genetic, the development of late effects in the patients. This is going to take some time and also some blood samples from patients across Europe, but we believe that we are in a good road to achieve our goals. At the end, we also will do some experimental work with testicular and ovarian tissues. This is called gonadal tissues to understand how the damage from chemotherapeutics is occurring in the tissues. So the next slide shows what are the possible outcomes of our project. So probably we will improve clinical practice if we can get a better prediction, better awareness and education. We will learn from the patient experiences and we can improve the care that they receive. We hope we could influence policy and enhance cross-border collaboration at the end to improve the quality of life of AYA cancer survivors. In the next slide, we want to highlight that we have participatory compromise of our project to invite people that have the cancer experience that are helping us to develop the project in the best way. And this is really important. We are really doing this in co-creation with the patients. And we have found that people are interested to help us. So this is right now very encouraging. And in the next slide, we can see, and we are very happy that the EU has also chosen to make this group together in the quality of life cluster, 6 projects, 1 mission. And in our own project, Predict AYA, that started just 1 year ago, we have actually completed the design of the clinical studies, and we will start soon collecting the data. And I know the other projects are also starting in their ways. So I hope we will really synergize in these projects. The next slide tells that you can join us and you can follow our progress. At the moment, it's very little progress. It's only 1 year of the project, a lot of administrative work, paperwork, and ethical approvals, but we are starting. And we are very thankful for this support from the EU to our project. The next slide. Thank you.
Thank you, Kenny, for your wonderful presentation. We now have discussed how we can better understand and predict the risk of late effects. I think that both projects are wonderful, and I'm keeping my fingers crossed for, and I'm sure they are going to be successful. And now we're moving to the second part of the webinar, which will focus on living with and monitoring late effects throughout survivorship. So our next speaker is Dr. Elvira van Dalen from the Prinses Maxima Center in the Netherlands. Dr. van Dalen is a senior clinical scientist and epidemiologist and one of the coordinators of the International Late Effects of Childhood Cancer Guideline Harmonization Group. The PanCare for AYA is a project aiming at improving the health and quality of life of AYA cancer survivors by developing and implementing screening programs for late effects. Elvira, thank you very much for joining, and please, the floor is yours.
Yes, and thank you for that kind introduction, and of course for the opportunity to present the PanCare for AYA project. Let me see if I can share my screen. Yes, I think it's okay now, right? You can see my slides.
It's working, yeah.
Okay, good. That's good. Yes, so starting with the first slide. Well, you heard a lot about possible late effects and implications and things like that. Where we are going to look at in the PanCare for AYA project. So what is PanCare for AYA? It's a 5-year European funded research project that started last year to improve the health and quality of life of AYA cancer survivors. And a lot of them at the moment, it's important that you are aware of that, don't receive regular long-term follow-up care for late effects. So the project brings together 28 organizations from 14 countries, and it builds on existing knowledge to create international guidelines for screening and follow-up, and to design the AYA Cancer Survivor Screen program. And that will include peer support and also options for digital delivery. So after the AYA Cancer Survivor Screen program has been finalized, it will be tested, including 1,000 AYA cancer survivors in 11 different countries. And a replication toolkit will also be created to support scale up across Europe in the future. So how will we do this? Well, this slide shows you an overview of the project. And as you can see, there are different phases. There's a development phase, a testing phase, and a scale up and impact phase. And first, in the development phase, we will start with an international AYA specific long-term follow-up guideline that will be developed for different treatment-related late effects. and it will be both consensus and evidence-based, and it builds on existing knowledge that we already have. And that guideline will then be used to develop a novel person-centered screening program, and that is called the EYA Cancer Survivor Screen, and I will get to that in the next slides. But it will include a personalized treatment summary and a survivorship care plan. And it builds on existing treatment summaries and survivorship care plans from previous EU projects that have been done, like, for example, PanCare Follow-up and PanCare Surpass. And it will also include information from PanCare for AYA partners and from the broader literature. And it's important to know, and it's already been discussed in previous presentations, how important peer support is. So that will be integrated, and it will provide emotional, social, and practical support. And the peer support will be led by a trained EYA cancer survivor, and it will be using a train-the-trainer approach. And we will monitor it throughout the project, and if needed, it will be optimized. And then finally, for the development phase, in some countries, namely France, Italy, and Lithuania, digital tools, the Surpass and the Log After, will support the delivery of the program. So then in the second phase, the test phase, we will look at the effectiveness of the program, the delivered care that reaches the survivors, feasibility, and also costs will be assessed. And then finally, in the scale up and the impact phase, we will make the replication toolkit, do the communications to everyone involved. So here you can see an outline of the EYA Cancer Survivor Screen program. And it involves several steps. First, there is the preparation for a clinic visit to a long-term follow-up clinic. And in preparation for that visit, the survivor fills out a questionnaire, and the healthcare provider generates an initial survivorship care plan. After that, there will be a clinic visit where the initial survivorship care plan will be reviewed with the survivor and the healthcare provider together. Recommendations in the plan will be discussed. If needed, diagnostic tests will be done. And if needed, the survivor gets referred for additional diagnostic tests. And that means, for example, well, you heard about the possibility of heart failure. So that will, if a survivor is at risk, that will be discussed during the clinic visit. For example, blood pressure will be measured, heart rate, things like that. But it's also possible that the survivor then gets referred to for example, an echocardiogram. So that's the clinic visit part. Then there is the post-clinic visit call, where and that happens after all the results from all the diagnostic tests are back. So then during that call, the healthcare provider and the survivor can discuss the results of the diagnostic test. If needed, refer to further tests, or if needed, treatments. And also during the call, the survivorship care plan will be finalized. And that is kind of like a lifelong survivorship care circle. In your survivorship care plan, it's, for example, stated how often you need to have a clinic visit, and then you know what to do. And because, of course, we are still preparing the EYA Cancer Survivor Screen, we also have the study, so that is shown here in orange. So at the different time points, survivors and healthcare professionals fill out a questionnaire asking about things related to that time point. And that's also after the clinic. We ask about how was the received care, how was the feasibility, things like that. But we also look at cost and other things. So what is our project timeline? Well, as I already stated that we started last year in 2025 with the project launch. We started the guideline process and we started with the peer support mapping. Then in 2026, the guideline and survivorship care plan will be finalized, and there will be an update of existing digital survivorship care tools. Then in 2027, the EYA Cancer Survivor Screen program will be finalized, and the multi-country implementation study will start in 11 different countries. And those countries reflect the diverse European healthcare systems because there is a lot of variation between countries. So then we learn if it works everywhere. In 2028, we hope to finalize the multi-country implementation study. And in 2029, we will do the analysis and we start developing the replication toolkit. And then finally, in 2030, we hope to have our final project results and the launch of the replication toolkits, so everyone throughout Europe can use our results. And then throughout the timeline, there will be always engagement with stakeholders, so survivors, healthcare professionals, but also policymakers. There will be communication of our project aims, collaboration with related projects, and dissemination of results. So what have we achieved so far? The guideline groups of healthcare professionals, researchers, and patient advocates have nearly finalized the recommendations for a total of 50 different late effects. And we started with existing recommendations and included literature updates. Then also the working group of healthcare professionals, researchers, and patient advocates are screening existing treatment summary and survivorship care plans to adapt for the EYA Cancer Survivor Screen program. So, patient advocates have mapped the available peer support and are currently developing training materials that can be used. The clinics are preparing for the multi-country implementation study. And finally, the digital tool developers have started to adapt the existing survivorship care tools. So what will be the impacts of PanCare for EYA? So let me get it. So first, there will be hopefully greater awareness where the need for EYA cancer survivorship care will be recognized by the survivors, by the healthcare professionals, but also by the policymakers and the society. Secondly, hopefully a better quality of life for the EYA cancer survivors, where there will be an improved physical and mental health, as well as a social well-being for all EYA cancer survivors in Europe. Also, hopefully, stronger care systems based on the harmonized guidelines that we will develop and a proven program for EYA cancer survivorship care, which will be supported by digital tools. And finally, a scalable solution by the freely available replication toolkit. So scalability and support uptake will be ensured. So thank you very much for your attention. And I was happy to present this very short overview of the project. Of course, a lot of information in a short time. If you want to see more about the project, you can go to this website. And I think maybe Colleen also started it, shared it in the chat. And if you have any questions, you can always email our deputy coordinator. Her email address is here, and on the website you can also find more information on how to contact us. So thank you very much for your attention. And I will stop sharing my screen. Let me see.
Okay, so thank you very much,
Somebody
Mira.
else stopped sharing, I think,
Yeah.
but okay.
Yeah.
Thank you for that.
Thank you very much. It may sound a little bit as a bias from me, since I'm a cardiologist, but a growing body of evidence indicate that cardiovascular health represents one of the major long-term challenges faced by many cancer survivors. So it is my pleasure to introduce Dr. Emilia Stepnowska, who is a cardiologist representing the MAIA project. The project focuses on empowering young cancer survivors through personalized AI-supported cardiovascular care and long-term risk assessment. Emilia, thank you very much for joining, and please, the floor is yours.
Thank you, Michal. Can you see my presentation?
Yes, it's perfect.
Good afternoon, ladies and gentlemen. Thank you for the opportunity to give this lecture. I have the honor of participating in the international MAIA project founded by the European Union. The topic of my presentation is living with and monitoring late effects. At the beginning, I would like to briefly introduce the kinds of challenges that young people may face after cancer treatment. Survivorship begins at the moment when everyone expects the patient to feel relief, but very often this is exactly when a new kind of uncertainty begins. For young people after cancer treatment, life doesn't simply return to where it was before diagnosis. They may be going back to university, starting a career, rebuilding relationships, or planning a family. Outwardly, treatment may be over, but inwardly, many questions remain like, am I healthy now? Which symptoms should I worry about? Can I trust my body again? This is the paradox of survivorship care. Follow-up is necessary. We need to observe late effects and long-term health risk. At the same time, repeated hospital visits keep a young person in the role of a patient just when they are trying to reclaim normal life. So the real challenge is not only to help people survive cancer, is to help them live beyond cancer with more confidence, more autonomy, and a better quality of life. That's why survivorship care should not be designed only around medical checkups. As discussed earlier, some cancer therapies may make the heart more vulnerable later in life. At first, these changes can be completely silent. A young survivor may feel well and look well, while early cardiovascular changes are already beginning to develop. That is exactly why follow-up matters. In cardio-oncology, we are not waiting for an event such as, for example, heart failure to appear. The point of follow-up is to notice smaller changes much earlier when they may be reversible or easier to manage. These early signals can be quite simple, like blood pressure starting to rise, weight gain, lower physical activity, reduced exercise tolerance, changes in heart rhythm, poor sleep, or symptoms that the patient may not immediately connect with the heart. Cardiovascular risk after cancer treatment is not the same for everyone. It depends on the type of therapy, the dose, the patient's age, symptoms, lifestyle, and other risk factors. This is why follow-up should be risk-based and personalized. Not everyone is the same intensity of observation, but everyone needs a plan that helps detect early changes before they become clinically significant. The Maya responds to these challenges. In this project, we are investigating whether the digital iCare Health Hub intervention, based among other elements on a smart mirror, artificial intelligence, and a virtual assistant, is acceptable and useful for young people after cancer treatment. We are also assessing whether this intervention can help improve quality of life, support lifestyle change, and contribute to better control of modifiable cardiovascular risk factors, including physical inactivity, obesity, unhealthy diet, smoking, hypertension. The Maya project is not about keeping patients in the hospital. It's about allowing them to live their lives while remaining safely connected to care. Health observation should feel like support, not surveillance. This is one of the key ideas in Maya. If we ask young survivors to observe their health, we have to remember that they are people trying to return to normal life. Digital follow-up can be helpful, but only if it feels safe and useful. But if it creates anxiety, guilt, or too many notifications, I believe people will quickly disengage. But if it gives clear feedback, helps them understand what is changing and shows what they can do next, it can become a real form of support. For me, good digital follow-up has three essential qualities. First, it must be understandable. The person should know what is being measured and why it matters. Second, it must be actionable. It should not simply say that something may be wrong. It should help guide the next step. And third, it must be connected to care. Digital tools should not replace clinicians. They should help identify when human support is needed. So the goal is not to watch people all the time, obviously. The goal is to give them confidence that they are not alone between clinic visits. In Maya, the home-based health hub includes a smart mirror, AI-supported tool with a virtual assistant and connected health devices. The virtual assistant supports young cancer survivors in everyday self-management. It helps them understand their health data, follow personalized lifestyle and exercise routines, ask questions, and feel more confident between clinical visits. But what kinds of wearable and connected devices are used in the Maya? The first is the BPM Vision that records blood pressure and heart rate. It also supports ECG-based rhythm assessment. The aim is to help follow trends over time and support communication with clinical care when needed. ScanWatch can record heart rate, single lead ECG with atrial fibrillation detection, irregular heart rate notifications, blood oxygen saturation, body temperature variation, sleep and breathing quality during the night, and physical activity. Last but not least, Body Smart that measures body weight and body composition. This slide presents the overall structure of the Maya project, which is divided into 3 phases. Phase 1 focuses on needs assessment. We work with young cancer survivors, healthcare professionals, and other stakeholders to understand what kind of support is actually needed after treatment. During phase 2, the aim is to check whether the intervention can be used in practice. And phase 3 is the main clinical evaluation phase. In this phase, the intervention is tested across several centers in a randomized control design. Recruitment for phase 3 is still ongoing. This phase will begin in June next year. This slide presents the main eligibility criteria for phase 3. The study will include people aged 15 to 39, either currently in treatment or post-treatment, but exclude those with no underlying cardiovascular conditions because this could affect both the interpretation of cardiovascular outcomes and the safety of the intervention. In this section, I have listed the clinical sites where the study will be conducted. And there is no doubt that the use of AI in medicine is becoming an inevitable part of modern healthcare. The aim should not be to resist it, but to use it responsibly. AI will not replace the physician, I hope, but clinical decisions, responsibility, and patient safety will remain with healthcare professionals. AI can support our work by making care more efficient, more personalized, and more responsive. It can also make follow-up more convenient for patients by enabling home-based support, reducing unnecessary hospital visits, and helping patients stay connected to care between appointments. It can help patients better understand their health, support self-management, provide clinicians with more structured information. Used responsible, I'm rather sure it will help improve patients' quality of life. The Maya project was created to meet these needs. Thank you very much for your attention.
Thank you, Emilia, for a wonderful presentation. We're moving forward. Our final project presentation focuses on digital innovation and patient empowerment. It is my great pleasure to introduce Professor Asta Pundziene from Kaunas University of Technology. Professor Pundziene leads research in digital healthcare innovation, artificial intelligence, and technology adoption in healthcare. The project aims to develop AI-driven solution that helps survivors manage the late effects of cancer treatment and improve their long-term well-being. Professor, thank you very much for joining us, and please share your slides and presentation. Thank you. I'm sorry, you're muted.
Okay, probably now you can hear me, right?
Yes, now it's perfect.
So good afternoon. Thank you for having us at this very much needed webinar that presents diverse solutions for AI monitoring, diverse but complementary. So I believe we can see the bigger picture on digital innovations in healthcare, and particular in cancer survivors addressed to AYA. And I will present Late AYA project funded by European Commission that stands for Understanding and Addressing Late Effects of Treatment of AYA Cancer Survivors, an AI-based digital phenotyping and non-invasive holistic approach. And we started the project, as most of the projects, last year, and we will continue for coming 4 years at present. We have a very rich consortium of 19 partners from 6 European Union countries, including in the consortium UK and Switzerland. The project is led by Polytechnical University of Madrid, and we have 7 clinical centers, 5 universities, 3 innovative SMEs, 3 research centers, and industry partner, including associated partners. So context, unmet needs and gap, and I would say I would echo most of already presenting colleagues that thanks God, survival rates are improving and growing population of AYA survivors. This is excellent news. However, the risk that is coming and was already mentioned, but just to really echo that, there are different, I would say, follow-up risks that are coming, including secondary cancers, relapse, as well as any other multimorbidities related with cardiovascular, endocrine, infertility, or chronic fatigue. In addition, there are other issues related with nutrition, cognitive, psychological, and psychoeconomical issues affecting daily life that is not less critical as physiological pains and inconvenience followed after the active treatment of cancer. And again, we acknowledge very similar challenges with the project, that we have a little evidence, data-based evidence, especially between the visits. So after the active treatment is completed, cancer survivors, they feel left alone because the next visit might be in a month, and each and you know better than me that each running nose or pain they take much harder than really people that haven't had experience of cancer. And the other challenge is really fragmented post-treatment care, as we have that issue that cancer survivors usually they were used to call their oncologist, and now they go to GPs. Probably they need a psychologist or any other healthcare specialist, and here they need some guidance how they should address their life after active treatment. So the goals of late AYA is, first of all, empower AYA cancer survivors, and we do that through personalized digital follow-up environments, and improving, or we seek to improve quality of life through managing late treatment effects. Key digital innovations like smart sensing, AI-driven risk predictions, chatbot, and of course, coaching and education, how to utilize digital technology at their best. Impact through excellence, leveraging our strong track records in biomedical research and digital innovations. So really setting the biomarkers that would help to predict and so to say make decisions and improve quality of life through the surviving period. And of course, long-term vision is that we have a standardized digital survivorship care and enable data-driven follow-up across Europe. There are like three key blocks of the activities in the project. And of course, first is digital health solution, starting with digital phenotyping, so really collecting data that helps to segment the cancer survivors, higher cancer survivors, and personalize digital solutions. Development of AI-based or driven models and analytics that help to guide right decisions, but also interventions that are stored, I will show later on in the library. And of course, personalized digital support based on previous actions targeting digital system development. Next big block of activities are related with clinical evaluation. So really testing the prototype and the solutions in real world settings, testing for the accuracy, but also for really usage of the technology by higher cancer survivors, but also by the healthcare professionals. So in that regard, the system that we intend to build should be user-friendly for both sides, the patients and the healthcare professionals. And of course, the last big block of activities are related with developing intervention framework, but also materials, new ones, but also using those that are already available with a clinical team. So research and innovation is just a summary what I was just describing through the activities, but it's important to mention that we have broad research questions related with how actually digital solutions and AI-driven solutions can improve quality of life of higher cancer survivors. And of course, how these automated interventions can reduce late effects of cancer treatment. So we believe we will contribute to answering these questions, research questions, with a new developed knowledge through the project. And methodology, we have, I would say, the experimental plan where we start collecting prospective data with, in that case, we use Samsung smartwatch and Android and Apple smartphones. And then we will test as intervention, the platform developed by our technical team. In general, the system, late IA system, should come from the needs of the higher cancer survivors. And this is our very important focus, that we start with living lab and assessing the needs. So we did a number of focus groups across Europe with higher cancer survivors, really to identify their user needs and experience regarding this kind of system. And we continue with phenotyping, addressing really safe data storage with European Health Data Space. It's still, I would say, in process. We check for data quality and, of course, assure the safety. I would say that next year we will already have prototype that will allow to visualize, and this is a small visualization how we expect to look the system with physiological data tendencies, dynamics on the screen in the apps, but also on the web with recommendations and answers to the users' questions, including personalized interventions that are coming through the chatbot run by AI through the Telegram system. And the healthcare professionals team, together with digital IoT technology system, hopefully will improve what we expect to improve quality of life, like AYA cancer survivors. This is more technical visualization. However, it's important to focus on a couple of things. First of all, we really think that the system should be compatible with European health data space, but also UNCAN and platform, EUC platform that really brings digital solution into one pan-European system. And of course, continuous development of counseling resources that would support mental well-being of AYA cancer survivors. So what we did at present, we already finalized the focus groups that I mentioned, and the outcomes are really rewarding, showing that there is a huge need really to bridge patient experience between the visits after the hospital and between the visits of healthcare professionals. And they really feel a bit lost because sometimes they have pains and want immediately to ask if it's related with possible relapse or it's just some kind of virus. And answering these questions, they really would feel more secure and feel less anxiety. And we hope that late AYA system would be able to answer these kind of small but very important questions coming when they are alone and don't have very structured support by the healthcare system. We already developed data models and set phenotyping process. Of course, all the ethical consents and the clinical protocol is developed to allow to proceed with data collection. And we really put a huge focus on co-designing the interfaces of the system together with the end users. So this is very much in short. If you have any questions, I hope we can answer that during the discussion.
Thank you very much for your excellent presentation. We're slightly over time, so let me quickly introduce Colleen Guillot, who is going to discuss the AYA quality of life cluster.
Yes, thank you very much, Michal. And just because we're running out of time, I suggest that we skip this part very quickly, as the cluster, the quality of life AYA cluster have been mentioned by I think Elvira and Kenny previously, and of course that is very important. And I strongly invite our lab attendees to invite our websites, the project websites, on which we'll find all the information related to the cluster. But let's move on to the Q&A, maybe if you want, Michal. I see that we have a question from one of our live attendee, someone that is referring to one of our panelists mentioning courses and conferences specifically focused on AYA oncology. Can you please recommend any? So I'm not sure who mentioned that previously, but if you have any recommendations, one of the panelists for our attendee.
Is anybody willing to answer this question? Difficult question.
On the spot like this, maybe yes.
Okay, I think I can start saying that this eye oncology is still a relatively young and rapidly developing field. So there are still relatively few conferences or educational programs. As far as I'm aware, there's an international conference on adolescent and young adult oncology, which is organized by COP and the European Network for Teenagers and Young Adults with Cancer. In addition, there are some initiatives, some sessions organized during major meetings such as at ESMO, ASCO, and COP, I think. That's from me. Would you have any other suggestions?
Go
But
ahead.
for the patient, maybe it's worth to check Global Eye Cancer Congress that probably this year it was in April, but yes, I have heard about such events, especially for Aya community, of course, clinicians, but also survivors. It was called like Global Aya Cancer Congress, probably. So maybe this is worth to check the conference, the Congress for also when the patients are invited.
Okay, thank you. Are there any other questions from the audience?
Oh, maybe I
Well,
can add something for the conferences.
sure.
I know, for example, in the Netherlands, we have the Space for Aya conference each year, and that also includes healthcare professionals, but also survivors. But I'm not aware of any that hasn't been mentioned yet otherwise.
I don't see any other questions from the audience. So unless, Michal, you have a follow-up questions to our panelists, we can
Yes,
over.
so since we have Ketiona with us, so I have one question. This is something for me as a clinician very important. From the patient's perspective, what information or support do young survivors most often say they are missing after the treatment ends? From your perspective, what should be improved?
Yeah, thanks for the question. So the most important thing is that, there is no guidelines that are very structured, or there is not a very, structured way to say that now that cancer treatment is over, this is what should follow up. So in the very first years, the follow-up continues to be done inside the hospital, usually that the patient was treated. But after that, there is a missing gap that the patients usually have to find their own way, and their own healthcare professionals in each, section on, how to navigate all the late effects that might occur. So in the past, we had, limited information about all the late effects. Now some work is being done. So we have some information about the late effects, that what might occur, for example, but there are not enough, structure guidelines to say this is where you should go. This is, there is, for example, this clinical hospital that you can go, and they have all the, different doctors that you could go there. And for me, what should be done is that, in each country, and this is one of our, jobs to advocate more about it, there should be at least, one place, like, for example, Princess Maxima has, that people should go and say, we are here, and we all know how, to help you, and we have the knowledge of what should be done next. And there should be a person that should bridge this gap between the when you leave the ward of where you were being treated and where you have to go next. So there are some countries, but they're not a lot of them that does this, but most of the countries, and I speak mostly about Europe, I don't know about USA, but I know that in other continents the numbers are worse than Europe. So I guess the situation might be worse, but there should be a person that says, I know how to navigate the healthcare system and what the late effects mean, and this can help you, and I will be alongside the way and to help you with that, because sometimes we are given all the information like boom, there you go, and then that's done. So I hope this more clear of what should be done next, and it's we should collaborate all together to bring these changes.
Okay, so thank you very much. Since we're over time, I'd like to sum up. So I would like to thank all our speakers for the excellent presentations. I think they were truly fantastic for your valuable contribution. Especially thank you to Colleen Gio for organizing today's webinar and bringing together all those fantastic projects that we could learn more about. I would like to thank all participants for joining us and for your interest in improving the long-term health and quality of life of our AYA cancer survivors. Thank you, Ketiona, for joining. Thank you very much, and we hope to see you again at future AYA survivorship events. And have a pleasant afternoon. Thank you.